What are some of the warning signs for family and friends? I mean, we've had two doctors, one EMT and one physician, they've taken their own life.
Yes, so absolutely in recognizing when, so it could go either way. They could become more agitated, more irritable, and just very small interactions and communications where normally you would anticipate that your partner would just kind of calmly respond. And that's just the stress getting to them. And so recognizing when you see that and inviting them to just take a moment to breathe and relax because they have to remember their own humanity, which is really hard, I think, for a lot of people in the medical field because they are looking to just take care of people. And what I learned when I was talking with my friends is that they kind of find themselves going into autopilot. So when they're at work, they're just like, I've got to do what I've got to do to get the job done. And then they come home and it's like all the feelings kind of dump on them all at once. And so recognizing if, your family member who works in the medical field becomes a little more irritable, if they're isolating, if you just recognize a significant change in how they're interacting with everyone, that those are major signals.
So many of these physicians and emergency room doctors go into this field because they want to make a difference. Yeah. And I think so many of them right now are feeling completely helpless, and that is another part of the story.
Even as a mental health professional, like you want to go in and you know that you want to be able to be of service to people, but specifically with the people in the medical profession, not being able to save as many lives as they would like certainly takes a toll on their mental and emotional health. Vicarious trauma is a very real thing where the trauma isn't exactly happening to you, but you're witnessing it and you're exposed to it in a removed way. And you may not think that you're affected, but you end up being affected because you are still witnessing something that is traumatic for someone.
So let's say I'm an emergency room doctor and I'm really struggling here. Mm-hmm. I call you up and I say, Erin, help me out. I can't see you because I could get you infected. Yeah. I don't have time to relax. I don't have time to take care of myself. I don't have time to go for a walk. I don't have time for yoga or meditation. What kind of advice would you tell that person?
I would absolutely assess just to kind of find out where you are with your anxiety and how you're managing the stress that you're under. But then I would also tell you that you have to prioritize it. I know that a lot of times we can feel like life is so busy, especially when you're on the front lines of handling an international pandemic. And you still have to remember your humanity. You are still a person. You are not capable of taking care of everyone all the time, which is really hard to process sometimes. But even if it's something small, just on your commute to and from work, listening to a podcast, listening to a meditation, listening to something that's going to help you relax. Because I even have friends who are in the medical field that are not into those kinds of things, like listening to some songs, create a playlist that is soothing to you or something like that, where that it'll help kind of bring you down or help you kind of temper your anxiety throughout the day.
Erin, are there resources available at most hospitals for frontline healthcare workers so they can, so they can go somewhere and talk to someone there?
I have learned at some hospitals they are setting up support groups for medical professionals who are directly in contact with people who have contracted coronavirus or who have been diagnosed with it, as well as people who are COVID adjacent. So that would be like your janitorial staff, the people working in the cafeteria, the people who happen to be at the hospital but are not working directly with the patients. There are groups that are set up at some hospitals where they can go and talk about their experiences and process, which I think is a brilliant idea.
What about the trauma they're facing now? Once this crisis is behind us, any kind of trauma we experience can last months, if not years. And the healthcare workers, those on the front lines, are no different. This will be with them for maybe a long time.
Yeah. So mentally, as a therapist, I'm preparing for that and what that's going to look like once things start to ease out with the pandemic. I would encourage people, even if you don't feel that you're being significantly impacted, to find someone to talk to, look into your Department of Health and Human Services, see what therapists are within your insurance companies and see someone that you can talk to begin to process this, because sometimes the effects don't start to show themselves until later. Like I said, a lot of medical professionals that I know have been saying that they're in autopilot, so they may not be processing it immediately, but your body does take record.
That's
Of the
right.
things you're
We
feeling.
call that post-traumatic stress. Erin Steele,
Yes.
thank you so much.
Thank you so much for having me.